So, ladies and gentlemen, it's a special day today. It is the 60th anniversary of the treatment of the very first patient by P-I Brånemark with oral implants. That happened on the 23rd of September in 1965. And to commemorate this event, we have presented a book that is going to be presented today. And I will read to you a bit from the foreword of this book. I first met P-I Brånemark in 1967. I had been recruited to his laboratories through my elder brother Björn, who defended his PhD thesis with Brånemark as a tutor in 1969, and then went on, my brother, to become an orthopedic surgeon. It was customary for young co-workers of Brånemark to run a research project parallel to one's own studies at the medical school. I started investigating microcirculation by using the rabbit ear chamber to visualize the capillaries. My PhD project was a combination of microcirculation, bone grafts and implants. I used the further development of Brånemark's old bone chamber and was able to autologically graft an implant with surrounding bone tissues. P-I Brånemark's laboratories were a melting pot vibrating with research efforts in different fields such as nerve reconstruction, microcirculation and bone biology, the latter subgroup with time under my own command. Subgroup leaders were given great freedom in selecting research topics, and it became quite natural for me to early on include implant research. When you were one of Brånemark's pupils, you always looked for the clinical applications of your findings. What we conducted was a sort of directed basic research with the ultimate aim to increase our knowledge in the clinical field. In retrospect, our laboratory scientists were pioneers in applied biomaterials research and belonged to the first generation ever using foreign materials to replace dysfunctional anatomical structures. Certainly, not everyone supported our ambitions in the beginning. P-I Brånemark had a long-standing feud with traditional dentists who did not believe in dental implants. They considered those impossible to connect with clinical function. The academic feud, I fear, was worsened a bit by P-I's personality. He was not the one who, when attacked, would turn his other cheek to his opponents. For example, a journalist had written a paper about P-I's microcirculatory research and published his report in Reader's Digest. And a dentist accused P-I of publishing in low-grade journals. P-I's response to the dentist who had previously issued and recommended a particular toothpick was that publishing oneself on the reverse side of the toothpick boxes was definitely anything but a scientific achievement. Finally, in 1977, our Board of Welfare sent 3 independent experts from our northernmost University of Umeå to Gothenburg, picked out a number of our patients randomly from our clinical records, and then wrote the first academic support of dental implants ever published. From then on, we started educating Scandinavian dentists on how to place dental implants, even if our own major clinical efforts at the same time were directed toward ENT implants, in close cooperation with Anders Källström, one of the authors of the present volume. Another author in this volume came for training in Sweden in the latter part of 1978, when we trained the team under George Saab of the University of Toronto in Canada how to place dental implants. Saab became instrumental in spreading the news about osseointegration to colleagues outside Scandinavia, as is evident from his chapter about the Toronto Conference of 1982. George Saab further became my personal mentor. And I feel proud today, having had mentors like P-I Brånemark and George Saab, both of whom have meant a lot to me personally. P-I Brånemark himself signed a consultancy agreement with Nobel Pharma in 1978 that, if in different forms, lasted until he passed away in 2014. Nobel Pharma, later renamed Nobel Biocare, was initially a university-affiliated research endeavor that was transformed into a large-cap company on the Swedish Stock Exchange in less than 10 years by leading managers Ek and Holmberg, who were invited to write another chapter in this volume, describing their experience in the field. During their time, Nobel was a general biomaterials company, supporting the development of extra-oral and orthopedic implants too, but they made the decision finally to transition Nobel to a dental implant company alone, and the other clinical applications were then sold to other interests. Implant veterans such as John Bransky, with his first publications in the dental implant field dating back to the 1970s, Mats Andersson, with his first implant-related CAM solution ever, Paulo Melor with his all-on-4 solution introduced more than 25 years ago, and Oded Bahar, of world renown for his clinical excellence, represent other friends of mine who have decided to contribute to this volume. There are a number of younger people, all of whom I can't list here, who have generously devoted their time in writing landmark chapters on various aspects of osseointegration. Our younger co-workers write about how we will step into the future, whereas we old folks usually talk about what we did in the past. Nevertheless, I feel that this volume will considerably increase our knowledge about osseointegrated implants and will be a landmark for the future. Bruno Karkanovic, my co-editor, has so far been academically active at the University of Malmö in southern Sweden, but he was originally trained in dentistry in Brazil and worked there as a clinician for more than 10 years. In fact, Bruno has published so many papers on dental implant that today he is the most quoted, still professionally active and not retired, researcher in Swedish odontology, according to Ioannidis of Stanford papers on scientific quotations. We have decided, as I said before, to publish this book in 2025 because this September 23rd commemorates the 60-year anniversary of Per Brånemark treating his very first totally dentulous patient, Mr. Gösta Larsson, who allowed us to quote his name in different publications. Today it's said that the world production of dental implants is about 20 million devices annually, and we have seen a similar positive development in the field of hip and knee arthroplasties too. However, despite the present popularity of implants, we still have many situations where we lack adequate clinical knowledge, which is why dental implants are anything but a commodity product. We are always in need of publications in peer-reviewed journals to learn more, and for the benefit of our patients, implants without any clinical documentation of their own should be avoided by any serious dentist in the field. We, the editors, feel certain you will learn a lot from the many chapters. Thank you.